became president in 1994, and while I was president, I worked with some tremendous people, both medical folks who were on the board as well as the staff here. And during the years that I was Director of Professional Relations, which I started in 1995, in September of 1995, when the opportunity came up that the position of CEO was open, I just felt that it was a natural transition to CEO to continue on the work that I had seen evolving in the BCMA. It was quite exciting and very rewarding to see the kind of impact that we could make on society in the delivery of healthcare. Things were very different to where they are today. We had a much smaller staff, perhaps 50 staff, and we also had to go ahead and initiate a levy to allow us to get into the negotiations and fund communications and an ad campaign in our negotiations with government. Today, we haven't had a dues increase to the membership for at least 7 years. And we certainly don't have to do any special levies, and we're very strong financially. So those are two critical differences just on the financial side and the ability to negotiate and lead the association on behalf of the membership. We also have, with the various programs that we're involved in, such as the PSP, the GPSE programs, divisions, attachments, as well as our PEDO and EMR program. We have grown tremendously over the last few years to be a very successful organization, and many would say that probably the most successful provincial medical association in the country. There were a lot of interesting politicians that we've met and dealt with, including various health ministers. Paul Ramsey, who was a health minister for the NDP, he'd come into our boardrooms and look out on the beautiful bay and say, well, that's why you docs are all in Vancouver, so you can get to your yachts that you have docked down there, and sarcasm would flow. There are other ministers that we've gotten along with well. There are some ministers in the past that took a really hard line to the physicians. But in general, relationships have been pretty stable. I will be 65 this coming year in 2012, and I've always felt that one should retire before 65, and I made that commitment to myself. As well, I always felt that one should pick their own time of retirement and not be there beyond their best buy date, and so chose to leave when things are really going well, and I'm quite capable of carrying on, and I'm intending to do some other stuff. Me a chance to spend a lot more time with my family, my grandkids. I have a few of those. My wife, whom I have not spent that much time with because of the heavy involvement in the BCMA and functions and travel. So I'm looking forward to that. I've got hobbies. I love photography. I want to combine that with travel. I'd like to get back into golf and improve my golf swing and hopefully play a little better than I have been, which some of my colleagues know is pretty crummy. So I'm looking forward to do that, and then see what other interests are around for me to keep myself busy. I do not intend to sort of just sit at home in my PJs all day. You learn how to deal with people. You learn the way the world really functions is dependent upon the individuals that you're working with, and that an association such as the BCMA is a living, dynamic organism. It isn't the building, it's the people that are in the building. And so you learn to build a team, and that's really important. And I've always maintained that probably the best asset that the association has is its staff. Certainly its membership is very important. There are the members, but we couldn't serve the members if we didn't have the staff. And one of the other things that you learn, and it's an evolutionary process, is respect. All of us have respect for each other, but you really learn that probably the most important thing when you're dealing with individuals is to be respectful of their views, not necessarily meaning that you agree with them, but you listen and then you treat them with respect that probably is the most important takeaway that I can say to people, particularly when I'm mentoring them, is to always have a lot of respect for the individuals you deal with. If you treat people with respect, you will get respect back, and you will be able to solve a lot of issues. Well, the next 5 years for the BCMA are going to be a major time of transition. There's economic issues that are facing the province and the country, and of course we're impacted with that. There's demographic issues that are affecting the population. So since we're a member-driven organization, we act on behalf of our membership, but we also support the public in a quest for better health care. Those issues are going to collide. It's in a way, if you want to call it, I hate the cliche, the perfect storm, but it's certainly coming together. You've got the aging population, you've got aging demographics within the health profession itself, whether it be physicians, nurses, other folks involved in the care of patients are all aging. So now you've got declining HR, human resources for provision of the health services. You've got an aging population that requires more. You've got a membership that is stressed. The amount of work that they can do in the workload with the declining resources is difficult. So we're going to have some tough times in the delivery of healthcare, and it's not a surprise to anybody. It's how we're going to adjust to that, and how we set our priorities, the kind of teamwork that we can set up in teams, and how we restructure the delivery of healthcare, both in the primary care sector and in the secondary tertiary care sectors that we have. Those are going to be the biggest challenges to the profession and to the association. If I could go back, I'd look at our governance structure. We've tried 3 or 4 times to create a representative forum, and it didn't fail by much during the vote, some 10% or so. But I really feel that we have to be more representative and hear more from our members. That's why we started the clinical fora that we have. But that's still fairly small and narrowed, and it would be nice to have a broader ability to communicate with the members in a way that they would find meaningful. I think that our board, for a large board, functions very well, and it seems to be doing very well. So it sort of is a hybrid version of a representative forum. It's not a forum, it's a board, but it brings representation into it, and for us it works quite well. I think that the members have to have an ability to have more greater input directly into us, and we're trying to do that. So that would be one thing I'd encourage to do. The other area that we've always had issues with, and if we could solve it, would be how we allocate funding and how we allocate payments. And that's always been an issue. It's not just in BC, it's global. And it hasn't been solved anywhere else to anyone's particular satisfaction, and it seems like we're still going to be having those issues here for a long time as well. It's a combination of many things that I look back on that I'm really pleased with, the kind of benefits we provide, basically all the structure that's improved over the last 15 years, 16 years where I've been here. I'm happy leaving with the association on a really good note in all sorts of ways.